and having a good time. How are you guys feeling? Feeling good?
Developments around boosters. We're going to talk about hospitalizations, and we'll talk a little bit about where we're going here. So let's start with the hospitalizations. There are 36 Nova Scotians in hospital with admission related to COVID. 5 of those 36 were hospitalized before the Omicron opened. So of those who are in hospital due to COVID, 4 are in the ICU. The range of age in those in hospital is from 19 to 98 years old. The average age is 72. There's nobody younger than 19 in hospital at this time. So of those in hospital, 77.8% are vaccinated to some degree. So we've had over 9,000 cases confirmed PCR tests in the last 2 weeks. Reference on hospitalizations on May 30th, we had May 30th, 2021, we had 580 active cases in the province, 585, sorry. 50 of those in hospital and 18 in ICU. So the case numbers are high, certainly very high as compared to what we're used to, but the variant is different. The world is also different. So looking at the data, 2 things so far remain consistent. Number one, this variant appears less severe, but the volume is certainly breathtaking. And the second thing is the vaccine works to reduce severe illness. At this volume, things can change very quickly. That's one thing during this pandemic is there's no need drawing lines in the sand because the sand shifts very, very quickly. So Dr. Strang and I will be back on Wednesday. At that time, we'll have 2 more days of information, 2 more days of research and discussions. And there are no new restrictions or changes for today. I would tell Nova Scotians we are watching and we will not hesitate to do whatever it is is necessary to keep Nova Scotians safe. So in the meantime, let's talk about the booster program. An incredible amount of work is being done to get boosters in arms. Today we opened up appointments for vaccines to everyone over 30 who is over that 6-month NACI eligibility criteria for booster doses. So thank you to everyone who booked. Certainly came out in droves. Thank you for that. We had 92,000 new January appointments opened in the system overnight. I believe they're pretty much all gone, or maybe even all gone by now as I speak. That means some people are happy with their appointments. Others are frustrated. But what I would say to them is more appointments. Last week we said that hundreds of thousands of January appointments would be open. They will. 92,000 were open today so far. The federal government has committed the supply to us. So we have enough for everyone over the coming weeks. The key to opening even more appointments than that number remains human resources. I want to thank everyone who has raised their hand and stepped up to help out delivering the boosters and the vaccines. We've had over, last count I had was over 1,000 individuals came forward to help. I can't thank them enough. Nothing says blue nose or spirit more than stepping up as you have, and I thank you tremendously for that. So right now the team is working tirelessly to contact one of those people who has put their name forward. And as more people come on board, more appointments will open up. It's that simple. So if you didn't get an appointment today, more will be opening regularly. So please check back. We will continue to update you and give you as much as we can. If we see large chunks of availabilities open up for new clinics, we'll let you know for sure. We want you to get appointments will continue to open up daily. With that, I continue to put the call out once again. If you're someone with experience in immunizations, a healthcare professional, a doctor, dentist, retired, practicing, whatever, if you have the ability to help, please go to shealth.ca /COVID jobs and reach out, and we'll be in touch with you for sure. So we'll contact you. So I'll now turn things over to Dr. Strang to talk more about exactly where we are and some perspective on that and maybe where we're headed. Dr. Strang?
Thank you, Premier. Good afternoon, everyone, and happy New Year to everybody watching. Very high case numbers we reported over the last few days. The Premier and I thought it was important to have a briefing today just to help alleviate any concern, anxiety that we know often comes with such high case numbers. I'm personally not at all surprised by the case numbers, despite hope that I had that we would have hit our peak. We certainly had more gatherings over the holidays, and those combined with a highly infectious variant was likely to lead to high case numbers, and that's exactly when you look at the timing of the onset of symptoms and testing. It's all consistent. People getting together. We even in small gatherings over the Christmas Day and Boxing Day. That's consistent. So we have to deal with that now. I'm not going to predict this will start to level off. I know that Omicron is here and it is roaring through the province at a very fast rate, but no different than what's happening in every other part of the country as well. So we need to assume that it is everywhere and accept that it's much easier to catch and spread than any other variant we face. And as I've said many times before, the main thing we need to watch and really shifting our focus is really on the hospitalization numbers, which the Premier has gone through. We still have our, while we watch the hospitalization numbers very closely, but the rate at which they are climbing compared to the amount of COVID we have is much at a lower rate. It's a positive sign that our ICU numbers, our overall hospitalizations is increasing moderately, that our ICU numbers are remaining very low and stable. So the healthcare system is managing the hospitalizations for now, but there are substantive operational impacts that are occurring through the healthcare system, from EHS to hospitals to long-term care. And these are really from the hundreds of staff that are off because they are positive, isolating because they've been identified as contacts. And that's something I know everyone is worried about, not having staff and the right staff with the right training to care for those who are sick and vulnerable. And this is not just in healthcare. There are operational impacts occurring in most other sectors as well. Right now, people are required to isolate for 10 days if they have COVID. Close contacts, depending on the situation, have to isolate for multiple days and have negative tests. There is evolving evidence on isolation times that the public health is assessing right now, today, and we'll have some final recommendations tomorrow that we'll be able to say more about at our briefing on Wednesday. We are in the most difficult stage of the pandemic yet. We are 2 years in. As everybody knows, we've had some form of restrictions, public health measures in place since March of 2020 here in Nova Scotia. Life was normal, in the fall, and then along came Omicron. There may be questions and skepticism about we're responding to the Omicron rate. I understand that this is very challenging and difficult. And it's quite likely that almost all of us have either had COVID, know someone who's had it, or been impacted as a close contact. Many of you may be thinking, and I've heard this there, that no one is very sick, no one is dying, and we just let this go and move on with our lives. We could, that's certainly an option, but that's not one that I would recommend at all this time, not yet. For most of us, the risk is low, but for some of us, the risk remains very high. And we need to think about people who can't get the vaccine, people who are already sick from other diseases or immune compromised, and older Nova Scotians. It's still very clear that the single biggest factor for severe disease is increasing age. We also need to think about healthcare workers who will be caring for these people. What if too many of them get? What happens then? So the things we have in place now will protect those who are most vulnerable in our healthcare system. But as you've heard me say before, it's about balance. Right now, we can't justify a stricter lockdown, but nor can we justify throwing the doors wide open. We can accept a fair spread of the virus to allow us to continue to do some of the things that protect our mental and emotional well-being and minimize financial impacts, such as seeing small groups of close family or friends, going to the gym, attending school. However, we also have to work together to slow the spread of the Omicron variant to protect vulnerable people in the healthcare system. So we all need to step up and strictly follow the personal protection measures that are in place. I am hearing concerning stories about people's, feeling complacent because, well, nobody in their life has been severely. What's all the? It's about, as always, doing what's necessary to protect those who are most in need of our help and our protection for them. So stay home if you're with cold or flu-like symptoms. Wear your mask. Wear it properly. And just a reminder, now we're recommending as a minimum that a 3-layer cloth mask, properly fitted and worn, is the type of mask you should be looking to use in the general public. Keeping physical distance where required and limiting your close social contacts all remain very important. And I would be remiss if I didn't mention the most thing that we can do to protect ourselves and others, and that's vaccination. The Premier spoke about our booster dose rollout, and I do want to also thank the team for what's been accomplished so far. And I'm also proud that Nova Scotians have stepped forward to help with this vaccine program and build capacity, both those who can immunize and those who can help in other ways. And we'll need more people to come in the days ahead to get the vaccine that we have in people's arms as quickly as possible. And again, I'm also proud that Nova Scotia are yet again prepared to do what it takes to fight COVID-19. The evidence is clear. Vaccination reduces severe illness and death from the virus and is critical to protect ourselves and others. Don't let anybody tell you otherwise. If we were dealing with Omicron without our very high vaccine, we would be in a much different and difficult situation. Our vaccination work over the last year is showing its ends now, but we need to continue to layer on the booster. We can't just vaccinate our way out of the Omicron wave. We have all the other measures that I've mentioned. That our vaccination rate is one of the key reasons why now, despite high rates of Omicron, we have very low rates of disease. The vaccine is working. It is protecting us, and getting a booster dose will maximize your protection. Your odds of getting infected, or if you do, of getting severely ill, decrease greatly when you have a booster dose. So those who are 30 and above, please, the many of you who have gotten an appointment, and the rest, there will be a lot more appointments for you, and please take advantage of that. Every person who gets a booster is another person who is optimally protected after 2 weeks from vaccination, and much less likely to get sick and transmit the disease. So again, if you're 30 and over and it's 168 days since your second dose of vaccine, go online and look for an appointment. If you can't find anything today, keep checking back, because we're always adding appointments continuously as more immunizers and clinics get operationalized and come online. And there's enough vaccine for everybody who's eligible to have their vaccination this month of January. And please, if you haven't yet had any doses of vaccine, or your child hasn't, it's never too late, and we'll soon be reaching the point where children 5 to 11 will start to become eligible for their second dose, equally important as well. With the amount of Omicron circulating in Nova Scotia, the chances of getting sick if you're not vaccinated are very high. There's no guarantee that you'll experience mild symptoms, and it's simply not worth the risk when everyone can have a safe, effective, and proven vaccine. And I've been asked a number of times whether people who have tested positive for COVID can get vaccinated. The answer is yes. Anyone who has had COVID can and should receive their vaccine, whether it's a first or booster dose, as soon as they recover, no longer have symptoms and have completed their isolation. There does seem to be a lot of anxiety about testing and a belief we don't have enough tests. We do have enough tests for everyone who needs one. We're just using them differently through the Omicron wave. People are showing up at tests to get rapid tests and getting upset when they can't get one. It seems people believe that they can access one rapid test per week. That's not. You can no longer get a test just so you can be sure you don't have COVID. We ask you that you understand you need to go online or call 811, complete a self-assessment. If you meet the criteria, they're really based on being identified as a contact of COVID or having symptoms yourself, then you can book an appointment to either pick up a rapid test kit and a PCR test, whichever you're in. System responding to this pandemic, including testing at our maximum capacity. And we're balancing caring for patients and managing the highest risk cases with access to testing and vaccine. And so in any community, there's always a balancing going on by the health authority and the WK. And we need to increase access to testing or vaccine, or there's surge in care demands. NSHA is always adjusting their resources to respond to the greatest of their ability. So please know that we are closely monitoring the different demands, and when we see adjustments and more resources needed in a certain area or in a certain area focus, access to testing in Cape Breton right now, for example, the health system will respond and respond quickly. I want to end today by reminding people Nova Scotia strong. January will be a tough month, and I expect that the Premier and I will have some more hard decisions to make. Omicron is pushing us to the limit and creating a difficult balancing act between controlling the virus and limiting significant impacts of restrictions. None of this is easy, and we need every Nova Scotian, including us, the Premier himself, to be at their best. Let these challenges bring out the finest qualities for all to see. We will get through this. Pandemics do end, and so we will get through the pandemic. But let's get through it by working together, caring for one another, and treating one another with kindness and respect. The challenges we are collectively facing are manageable. They are temporary. But the legacy we leave with our response will be permanent. Back to Marla.
Thank you, Dr. Strang. Thank you, Premier. We'll now take questions from media in the amount of time that we have. We'll do one question and one follow-up. Begin with Sarah Platt, CTV. Go ahead, Sarah.
Hi, Dr. Strang, you said that right now we can't justify a stricter lockdown or justify keeping the doors wide open. Can you give us a sense of what would justify a stricter lockdown? A lot of viewers who are asking us, well, why aren't we doing more to restrict this given other provinces are, and we're not immune to this?
We continue to look at a number of factors. What is our disease, but most importantly, we look at our hospitalization. What are we seeing in terms of the impacts on our hospitals? And that's the key metric to say, how do we navigate our way through this by keeping the rate of disease and especially the rate of severe disease within the capacity of the healthcare system. So much of this is about not stopping the spread, but it's slowing down the spread so all cases don't happen in a very short period of time. And we're still there. We are well within capacity of the health system. What's creating a lot of the pressure now is the many hundreds, if not thousands, of people in healthcare beyond isolating for various reasons. As I said, we are looking at that actively. We'll have more to say how we adjust in that area on Wednesday.
Sarah, do you have a follow-up question?
Yes, I do. Thank you. Regarding rapid tests, I know we're using them differently, but could you give us a sense of when we might receive more shipments of rapid tests and how many we might get and when that happens? They might be used. Is there a possibility that we will see asymptomatic testing again on a wider scale in the future? We're just waiting for those tests to arrive.
Yeah, we're still working with the federal government to understand exactly the timing and the amount of shipment that we'll get over the the next few weeks. Some of it depends a lot. What is the demand for testing for people who are symptomatic in our context? What I would envision for at least the next number of weeks until our case numbers start to go down substantively, that we're going to continue to focus on testing as we are now, with really the emphasis on whether it's PCR or rapid testing on people who have symptoms, and then helping contacts as well. We're also looking at again, as we get more clarity on supply, how do we support our schools with access to testing directly through schools like we've done previously, but this time looking at the ability to do that for all grades, P to 12 as well as for teachers. Again, as we get more clarity from on delivery of supply, we'll be able to firm up those details. But I don't see the focus of our testing changing in the short term.
We'll go to Alexa McLean with Global. Go ahead, Alexa. Okay, I think she might have just fallen off the call. Let's move on to Gareth Hampshire with CBC. Go ahead, Gareth.
Thank you. Dr. Strang, you alluded to the rapid testing changes there, and you mentioned Cape Breton, and people in Sydney are saying that the nearest places they can get appointments for the rapid tests are either Antigonish and Neils Harbour, which is obviously quite a drive. What steps are being taken to make them more available, and how soon do you think that can happen?
Yeah, there are actually, I believe, 3 right now existing sites in the Sydney area for rapid tests, and we're ramping up supply and hours for appointments very quickly to address those concerns. As you know, there's been a surge of cases in that part of the province. So, as I mentioned in my remarks, we're continuing to monitor these things and be as responsive as we can. But we also need people to help us out. That we understand that you need to meet certain criteria before you're eligible for a test, and we also need people to make appointments. We still have people showing up with no appointment, thinking they can get a test kit and thinking they can come every week just to get a supply of test kits. That's not feasible to do that right now. So the system will respond as best we can, but we need Nova Scotians to respond as well and be responsible. How they are the supports that they're seeking from the healthcare system, whether it's testing, vaccination, or seeking care.
Gareth, follow-up question?
Yes, thank you. Maybe, Premier, you could address that as well. There seems to be quite a bit of anxiety about access to the rapid test. What's your advice to people who are trying to get hold of them in and outside of Halifax? Yeah,
the same as Dr. Strang's. I mean, we recognize that we've had a testing philosophy here, which has served us very well, and it was based on surveillance. We wanted to do a lot of testing, asymptomatic, symptomatic, whatever. We wanted a lot of testing in the province so we could understand the existence of COVID in the province. So surveillance-based testing. It had twofold though, because it was surveillance-based. It was information for public health and for the government, but it also it gave people a sense of security. I'll say that, but we're at a different stage now in the pandemic. We have less of a need for the surveillance part, because the reality is there's a lot of COVID around. There's just a lot of COVID around. We don't need a lot of asymptomatic rapid testing to tell Nova Scotians there's a lot of COVID around. And so we also need people to modify behaviors and expect that if they're in a large group of people, there probably is somebody in that room who has COVID. So, you know, there's a lot of things happening here. It's a lot, all of us. You know, there's definitely a need for testing. There's no question about that. And we want people to be able to get that test when they're eligible. So as Dr. Strang said, we are working to get more supply. We're working to stand up clinics, also working to balance that with the boosting exercise. So there's a lot of work being done. I know people are frustrated because it's a different stage in the pandemic. It requires a different response, and that's a shift. And shifts are different. They're challenges for people. So my message to people is we hear you. We understand the importance of boosting. We understand the importance of testing, and there's a lot of people working very hard to make sure people can access what they need when they need it.
We'll go to Sarah with the Canadian Press. Go, Sarah.
There. Doctor, I'm wondering, what are you taking away from the province's low hospitalization rate? A reason to be optimistic?
Well, I'm encouraged by the fact that we have our hospitalizations while they're increasing moderately, and a very low percentage of probably well below 0.5% of people who are affected are actually ending up in hospital, and also encouraged that the majority of people are not requiring, even though they're in hospital, are not requiring ICU care. But we also have to continue to be careful. That could change very quickly if we just let things go. So January is going to be tough. I think we have good things in place to focus on keeping that level of hospitalization in the capacity of the healthcare system. But to do that requires all of us to really continue the really hard work for the next few weeks. So buckle down for January, keep us in the reasonably good spot that we're at in terms of our hospitals, and we'll get through this as things start. Anticipate the pressure likely starting to ease off in February and into as spring comes. But we can't get ahead of ourselves, and right now we still have a lot of hard work ahead of in the days and weeks ahead, along with as we've all talked, the Premier about starts with vaccination, but then following the other things that we're asking people to do in terms of testing, following personal measures. That's what each of us need to focus on to keep those hospitalization numbers in the kind of the manageable state that they're at.
Do you have a follow-up question?
No, thank you. Okay, thank you.
Perfect. We'll move on to Jen Taplin with the Chronicle Herald. Go ahead, Jen.
Parents are really concerned. Do you expect many parents will not send their kids to school next week? And how can you assure them it's safe?
So, I understand. The school decision was probably one of the hardest decisions that I've made, and brought forward recommendations throughout the whole. But at the end of the day, where we've landed is that there's a significant risk for kids not being in school, and if we look at the overall well-being of children, that the best place for them to be is in-person learning. I recognize that family has unique circumstances. So, but I do know that the education system has well-established processes in place that individual students that for whatever reason can't be in school, that there are ways for them to get the support from the education system, and we'll be talking more on Wednesday about this. We're putting in, as we've had previously, multiple layers of protection around. Keeping kids in classroom cohorts, minimizing movements around the school, limiting external visitors. But it starts with if children or teachers, they need to stay home and not be in school. Using masking carefully and appropriately within the school and other things. Looking at ways to improve ventilation. All those factors are different layers that apply a reasonable level of safety. The reality is we are going to get COVID in schools, but those layers of safety will help decrease any transmission that happens within that setting, but also acknowledging that the critical importance of children for being in-person learning wherever possible.
Jen, do you have a follow-up question?
I was just curious, how many people have forward to in the past week to help with the vaccination clinics, and how many more are needed?
I don't have a specific number on that. I mean, it's more than I was asked at the last briefing. We continue to get more and more people used forward, whether it's immunizers or other options in clinics, and we'll take everybody that we can. So if you're interested, you can go online to the Nova Scotia Health COVID website, where there's a place both for to volunteer for both, either whether it's immunizers or many of the other jobs that are necessary for our mass clinics.
Just on that, we've had over 1,000. We can get you the exact number, but it was over 1,000 last time I checked, and I know people were still expressing an interest to me. So at the moment, people are contacting those people and just making sure that we get the right skill sets. So, but over 1,000, we can get a better number for that though if you need one.
Okay, we're going to move back to Alexa playing with Global. Go ahead, Alexa. Alexa, are you there? Okay, we'll go to Tim with the Halifax Examiner. Go ahead, Tim.
Hi, good afternoon. Dr. Strang, you keep saying that instead of daily case counts, we should be focusing on hospitalizations. Generally speaking, we're not getting that data. Over the 2 long holiday weekends, we didn't get hospitalization numbers at all. We're not told what the vaccination status of those in hospital is. We're not told how long they're in hospital. The release today said that 31 people have been hospitalized since Omicron. So are we to understand that no one left the hospital? We have no idea about the age of the people in hospital, on and on and on. It was helpful that the Premier said some of this information today, but can we expect to get some of this information on a daily basis moving forward?
Yeah, I'm not going to commit to daily, but we are looking at how we provide more robust hospitalization data as we move forward. I mean, I think we were developing our hospital surveillance systems. I hope you can appreciate that we, in the midst of the Omicron, we have people who've been for 2 years, and I was trying to get some people a little bit of time over the holiday period, so we only focused on what was critically essential. Now we're back, and you can expect to see more robust hospitalization data moving forward.
Tim, do you have a follow-up question?
I do. On that, that's good to hear, and thank you. On that, I want to ask it more pointedly. 31 people have entered the hospital because of COVID since Omicron. Again, have none of them left, or are there short stays and they're being replaced? What's the situation there?
So we'll get more. I mean, their average length of stay is some of them are in the emergency room. They are admitted. I've been there for a few days, so there is some turnover. But our overall numbers are staying well within our capacity. So again, we'll have more robust breakdowns of that as we move forward.
Next, we'll move to Adrian Blanc with Radio Canada. Adrian.
Good afternoon. Houston, how confident are you that schools will be able to reopen, considering that we can see that more and more people are close contact and to isolate temporarily? And what kind of measures can we expect to be announced before the schools reopen in January?
Yeah, I mean, as confident as you can be with anything in the middle of a pandemic, things change very, very quickly. But, Dr. Strang spoke to the fact that we believe the best place for our students is in schools. So we will take every step we can to make sure that that they're safe in the school. That includes masking. We're looking. I was asked last time about the ventilation systems. We're looking at that. We want parents to know that their children will be safe in school, and that teachers, and we want the teachers to know they'll be safe in school. So we'll take the steps. If things change and we have any concerns whatsoever, then we'll change. We'll move with it. So we've got school in-person learning is scheduled to start a week from today. And we got a press conference on Wednesday. We'll continue to look at the data. We'll continue to have discussions. But if we feel confident that school can be opened in person safely, then we will open it in person. If we have other data or other concerns, then we'll make an adjustment, and we'll speak more to that on Wednesday as it gets closer.
Adrian, do you have a follow-up question?
Yes, question that I think for you both. We can see that Ontario has implemented again stronger restrictions. How is Nova Scotia different from Ontario in that regard? Well,
I mean, I'll speak to it, then maybe Dr. Strang might want to, but every jurisdiction is a little different in terms of the actual demographic of the population, in terms of the vaccination rates of the population. I think, when you look at the variants and look at what was happening in Nova Scotia before the Omicron wave, other areas or Delta, which was a different variant. So there's lots of factors, but you're right. There's also a lot of similarities. So we're having these discussions. We're looking at the data, and I think as a province, Nova Scotia has shown that it will move, and it will move very quickly in the interest of public safety, and that stands just as much today as it ever did before. But I don't know, Dr. Strang, if you want to add to that.
Yeah, as the Premier said, throughout the whole pandemic, every province has been somewhat different with our own epidemiology and circumstances. Fairly strong measures that are in place at least until January 10th, and I fully expect that they will need to extend beyond January the 12th. But again, every measure has its own set of impacts, and this is all about balancing what is necessary to control COVID versus minimizing the impacts of the substantive impacts that can happen from restrictions. And I think we're in a good place right now. Again, it's not about stopping the spread of COVID so much as slowing down its spread. So the impacts, which will occur, but we'll out of this, but we spread out the impacts over a period of time that are within the capacity of our healthcare system. And so far, I think we're doing a good job of that. Continue to watch things carefully and course correct if necessary. But at this point in time, I have not felt the need to bring forward recommendations to strengthen restrictions, but I think fair warning for Nova Scotians that extension of the existing restrictions is quite likely to be coming.
Next, we'll go to Nicole Sullivan with the Cape Breton Post. Go ahead, Nicole.
Thank you. Dr. Strang, this is for you. Just, you touched a little bit on Cape Breton. It's extremely difficult in Cape Breton to even get appointments to pick up rapid testing anywhere on the island. I've spoken to healthcare workers, both hospital, both long-term care facility, who had symptoms Thursday and Friday, still unable to get an appointment to be able to get their tests. So, I know you urge that it's important to not just show up, but these people, they can't get their tests, they're symptomatic. So I'm wondering, why is the system set up so that you can only book for 3 days in advance? And why can't somebody like a continuing care assistant or a hospital worker pick up tests from their employers?
So we are focusing on our workplace test strategy. We are continuing to provide rapid tests through what we call high-risk workplace, such as healthcare settings and long-term care facilities and other kind of congregate living settings. So that is still available. There's been, in just the last days, an increase in cases in the Cape Breton area. As I said, the health system is rapidly adjusting, redeploying supply and opening up appointments and other opportunities to address demand as quickly as possible.
Nicole, do you have a follow-up question?
Yeah, I do. Thank you. I'm wondering, when it comes to the rapid tests versus the PCR tests, I know through our health system, we're recognizing the tests as being active tests. Yes, you have COVID. If somebody has a rapid test, but they develop long COVID symptoms, how much is that test going to be accepted outside of public health and NSH for, say, term or short-term disability claims through insurance companies?
So we're setting up a So certainly now with the level of spread of COVID, that we're very comfortable. You know, rapid test means you have COVID, and we are setting up a process that you know, for or it's there for people can report that into the healthcare system. We're aware of the need. Some people may need more formal documentation, so we're establishing a process over time. If people need some kind of an official documentation, knowing that they had a rapid test, that we'll have a way to provide them with that documentation.
Next, we'll go to Pat Healy with the Lake. Go ahead, Pat.
This question for Premier Houston. How will the province ensure staffing levels at schools are maintained given the fast spread of Omicron, and if a large amount of teachers have to go off work into isolation?
Thank you, Pat, for the question. We're concerned about this in healthcare and in education, but across our economy. I mean, I've spoke to a number of business owners who are finding it difficult to keep operations because of the vast number of Nova Scotians that are on because they were close contact or are sick. So it's a big issue in education. It will be as well. So we'll watch closely. There's been some standard protocols for when the school needs to be closed. One of those will be operational issues. If we just don't have the people to operate it, then we won't be able to keep the school open. So we're concerned. There's no question about that. I don't want to minimize the concern, but we're watching very closely with what's happening across the community.
Pat, do you have a follow-up question?
Yes, I do. Dr. Strang, if you get COVID-19, how long do you have to wait before you can get your booster dose?
So we're saying that we certainly, even if you have an infection, it's still important to follow up with whether it's you're completing your first dose, second dose, or your booster dose. You should wait until, first of all, you're no longer considered infectious, and also that you're feeling better. Once you meet those two criteria, you can go ahead and get finish your series, including a booster with COVID vaccine.
Next, we'll go to Lindsay Armstrong with the Coast. Go ahead, Lindsay.
Thank you very much. Question for Premier and Dr. Strang, looking at ventilation in schools. Are you looking at actually establishing active ventilation systems in the schools that currently rely on passive ventilation before the kids return? And will teachers still be asked to open up windows as ventilation this January?
Thank you for the question. There's lots of discussion about ventilation in the schools, and this is something that's an active file, and my understanding is that 70 to 80% of the schools have pretty high quality HVAC system, and there are other schools that need that have an older ventilation system. So what we're looking at is what we can do to, but I want to say this against the fact that there's public health has not identified any issues with the ventilation in the schools. But that said, we hear what's happening in the community, and we want to be responsive. So we're looking at those schools that you mentioned. I think it's about 70 schools in number, but that's an active file. Seeing what we can do in terms of setting up systems in the classrooms there. So it's happening in real time. I think there's some just procurement discussions that are happening right now as well. So, but to answer your question about will that be before the start of school, I think it will be. But it's something that we're focused on. I don't know, Dr. Strang, if you want to add to that.
Yeah, I think, improving ventilation or optimizing ventilation is important, but again, it's one of multiple layers. So I always come back to we have to have the multiple layer approach, and it's all those different layers, none of which by themselves are perfect, but it's the layers working together which provide good levels of protection.
Lindsay, do you have a follow-up question?
Yes, thank you very much for that. A question for Dr. Strang. I'm wondering if you have any update or discussions regarding ending daily case counts. I'm wondering what the other provinces thought about, if you have a timeline for when you expect to end this practice.
No, I brought that issue forward at my last national call on Thursday. There was lots of support from my Chief Medical Officer of Health colleagues around moving away from daily case counts. but also doing that in a consistent way in terms of timing and what it looks like. A commitment by the Public Health Agency of Canada, who kind of chairs those national meetings, to have this as an ongoing agenda item as we move forward. You know, we usually have two. I'll have a call tomorrow, another one Thursday. We have 2 calls a week, so look forward to that conversation unfolding with my colleagues across the country.
Next, we'll go to Adam Cook with Teleo Community Television. Go ahead, Adam.
Thank you very much, Marla. I'd like to begin with Premier Houston, if I could, although Dr. Strang, you may have insight on this as well. Premier, during the last COVID-19 media briefing this past Thursday, you stressed the importance of volunteers coming forward and staffers coming forward to vaccination clinics. And you mentioned that the eastern and western zones were starting to ramp up in those particular areas. Are you able to discuss at this time what exactly that will involve and what the timeline is for getting these community clinics up and running?
Thank you, Adam. And I can tell you there's a major push inside of public health and the Department of Health, of course, with the health authority as well, to get as many of these clinics going as we can. And you know, we've mentioned the supply is there, so now it's the resources. So I will get a more accurate number, but the number that I have is 1,000 Nova Scotians have stepped forward to help out. And the more people that step forward and help out, the quicker we can get the boosters in our arms, whether that's support in a pharmacy or community clinic or whatever the case may be. We'll make them available wherever we can. So it's all about the push to get people qualified. That push is active, and I would say I'm very optimistic about the response of Nova Scotians and the willingness to step up and help out at this time. So we'll have more news as we can open more clinics, open more appointments. We opened 92,000 overnight. I think they're pretty much all booked now. We'll continue to open appointments, but it's the people stepping up is what really gets us over the top on that.
Just to add to that, we have been able to get an updated number. It's 1,646 Nova have come forward to help deliver vaccines. So that was 1,646. Adam, do you have a follow-up?
I do. Thank you, Marla. Dr. Strang, wanted to bring up the concept that was mentioned by one of my fellow reporters concerning getting testing done in Cape Breton. And I'm curious about a system that was used to provide rapid tests just up until the middle of December, that being the Nova Scotia Library system. Rapid tests were available there. Can you give us some thoughts on why that system is no longer in place? Was it basically surging cases and an increased demand for rapid tests? Or was it just felt that other vehicles such as the Nova Scotia Health Authority and its various health centers would be better to distribute these than the library system?
So it was both a combination of the surge in cases and prioritizing our testing in certain areas, as well as we'd had some decreased supply, which we're actively replenishing. We still, as we get more supply, we may go back to looking at libraries as an access. As I said, there's active discussions going on around how we, especially in our more rural communities, how we make there's regional. Close in terms of geography, access to rapid testing. Being able to get people get rapid testing. We haven't ruled out that we may not use libraries as part of that as we move forward. Again, a number of initiatives that we're looking at, and it comes back to feasible given our focus of testing and also what supply that we have available.
Next, we'll go to Lois Ann with the Guysborough Journal. Go ahead, Lois Ann.
Yes, hello, good afternoon. I have only one question to follow up. Is there a hospitalization threshold that will trigger more restrictions, such as a percentage of all active cases? Thank you.
No, as I've said many times before, we don't, there's a number of data pieces and contextual pieces that we look at to make decisions. There's not one specific threshold that, in terms of hospitalizations, that if you hit that, then you have to restrictions. It's looking at data points, context around that data points and what's the total picture that we're looking at to make decisions.
Okay, we'll go next to Drake Lathers with Port Hawkesbury Reporter. Go ahead, Drake.
I know you mentioned you weren't surprised with the high case numbers over the holidays, but was the almost 1,900 cases announced on par, higher, or lower than what you and your team were expecting?
I mean, it was. I wasn't totally surprised. It was, that was a very high number. Again, I'm not out of the realm of possibility, given what the types of the high infectious nature of the Omicron variant and the decisions we'd made. Small group gatherings as over the Christmas holidays for obvious, beneficial reasons for people and families. And so now moving forward, we continue to manage things. It's not about the total of cases and the spread of COVID, as much as slowing down that spread to the point where we can manage things within our hospital system, keeping a very close eye on the various data points around who's coming in the hospital under what circumstances.
Eric, do you have a follow-up?
Yes, I do. And just touching on those data points that you'd be looking at to make those restrictions or make those decisions, are we ever going to a point where we'll have to implement increased restrictions on fully vaccinated and boosted individuals?
So, that's, I'll never say never to things, but certainly we know that, people that are even with 2 doses of vaccine have good protection against severe disease, and a booster gives them even very good protection against severe disease and brings their protection against getting infected back to the level that it was when we had the Delta variant around. Certainly vaccination gives people much more protection. And I think we always need to accommodate that when we look at the type of restrictions and what's necessary for people who are vaccinated versus unvaccinated.
We have time for one more question. We'll go to Stephen Wenzel with City News Halifax. Go ahead, Stephen.
Thank you. An infection control epidemiologist in Ontario is calling for schools in that province to remain closed until at least January 24th. In a letter to Toronto Public Health, he premature return to learning cause, quote, all students attending schools and daycares in Ontario to become exposed to COVID-19 within a few days of opening, with estimates of up to 2,750 children in Ontario being hospitalized throughout this wave. Children under 12 are not yet fully vaccinated, and elementary school classrooms remain the largest unvaccinated gathering in the country. Doesn't the idea that the safest place for kids to be is in school contradicting the science?
No, in fact, it's one person's opinion. There were 500 physicians in Ontario who wrote a letter very recently, a public letter, asking the Ontario government to keep schools open. So there are strong opinions on either side. But when we look at the Nova Scotia context right now, we're comfortable with the position we've taken about balancing the need to control COVID versus minimizing harm from restrictions, and knowing the substantive, I have to keep coming back to this, the very substantive harm that occur when we have kids out of school for long periods of time. But as the Premier said, we'll continue to look at things and adjust as necessary. But right now, we're very comfortable with the position we're landing about balancing multiple perspectives and having in school with multiple of safety to protect them and teachers.
Stephen, do you have a question?
Sure. Will you be requiring proof of vaccination to become mandatory in schools for children 5 or older?
We have not at this point contemplating proof of vaccination for 5 to 11-year-olds, and we've always said that proof of vaccination would not apply regardless of age for essential or access to essential services like healthcare, and I would consider education up there as essential healthcare for children.
And that's all the time we have today. Go ahead, Premier.
Thank you, Marla. Thanks, everyone, for the questions. These are certainly the questions on the minds of Nova Scotians. We'll bring them as well, for sure. But the reality is that COVID is all around us now, whether in Nova Scotia, PEI, Quebec, New Brunswick, Newfoundland, on and on, other countries. COVID is everywhere with this variant. Most Nova Scotians know somebody who's had COVID at this stage. And probably have seen or heard that the person recovered fairly quickly. That's happening a lot with this variant. Seems to be the norm. Some people do end up in hospital, and that is what the focus is. Making sure that the healthcare system, that the hospital system is there to support those that need it. That's our entire focus right now. So we're watching that very closely. So. Thank all those Nova Scotians during the holiday season. I know it was tough to limit the groups and to miss some of the traditions of the holiday season, particularly around being around extended family. It's really tough, and I really thank you for stepping up and doing what public health asked of you. I can't thank you enough for that. You're taking responsibility for your own actions to protect your community and to protect those around you. So thank you for doing that. We'll continue to add booster appointments. We'll continue to look at the science. We'll continue to understand the impact of COVID on Nova Scotia in our demographic, in our population. We're watching very closely. And public health and myself and our team, we will act very quickly as necessary with one goal. And that's the safety of Nova Scotians. So thank you for your time today. See you all on Wednesday. Thank you.
Having a good time. How are you guys feeling? Feeling good?
Gala, and it's all in support of the Annapolis Valley Honor Choir.
That's a cream sauce, but it's not going to be a cream sauce on